Everyone, let's just quickly revise important images of radiology. So the first image is an IVP. What you see here is the ureter. These are the calyces, and this is the collecting duct. Now normally you will not see the collecting ducts, but when they are dilated, as in case of medullary sponge disease, then you can see it. Okay, so this gives a bouquet of flower appearance of medullary sponge disease. So welcoming you all with this bouquet of flower of medullary sponge disease. This also looks like paintbrush, so we call it the paintbrush appearance as well. Next up, look at this ureter. This is lower below as compared to the left ureter, isn't it? So this is seen in duplicated collecting system. So this is the drooping lily sign of duplicated collecting system. Now in this one, if you look at the ureters, these are closer together. This is seen in horseshoe kidney. So in horseshoe kidney, the lower pole of the kidney, they are fused together, giving appearance of a handshake sign. This is also compared to a flower vase. So I'll just trace the flower vase for you. This is the flower vase, and these calyces represents the flowers here. Next, look at this ureter here. There's a sharp bend that you can see in the ureter. So this is seen in retrocaval ureter. Okay, retro is behind. Caval here refers to the inferior vena cava, behind which the ureter takes a turn. Okay, so because of the sharp turn, you can see this turn in the IVP as well. So because it is behind the inferior vena cava, it gets obstructed. So that's why the proximal part gets dilated. So this gives an appearance of a fish hook. So fish hook appearance of retrocaval ureter. Next, look at this ureter here, and the proximal part is dilated. Now this is seen in retroperitoneal fibrosis, where because of the fibrosis, the ureters are closer together. Okay, closer together, giving it a cinched in appearance or the maiden waist appearance, which is seen in retroperitoneal fibrosis. Okay, so that's all about the IVPs. Now you're looking at an X-ray where there's a radiodense structure here. Now this is a stone. Okay, and what stone is it? This is a Staghorn Calculus or the triple phosphate stone. Now this is very important. Here triple refers to calcium, magnesium and ammonium phosphate. Okay, that is the composition of this stone, and it has a staghorn appearance. This is a gross image and this looks like a staghorn, and the shape is the coffin lid shape. Few more important MCQs that they ask, that the stone is formed in alkaline infected urine. Okay, and it is infected by Proteus, and this is the most radiodense stone. Next, okay, look at the bladder here. This have become very small, and this small bladder is seen in renal tuberculosis, and the shape is compared to that of a thimble. Now we'll look at some other shapes of bladder. So the first one, look at this. Here we have not used any contrast. This is calcified, and that's why the bladder is visible like this. So this is due to an infection, that is schistosomiasis, and this is giving an appearance of a fetal skull. So fetal skull bladder in schistosomiasis. And here is a pretty Christmas tree appearance of neurogenic bladder. Next up, okay, this is the last shape. Look at this bladder, and this is looking like a teardrop bladder. So whenever there's a mass here, the lower part of the bladder is going to get obstructed, right? And so the bladder, because of the obstruction of bladder neck due to any of this condition, pelvic abscess or hematoma or lipomatosis or enlargement of the lymph nodes here, will give rise to teardrop shaped bladder. Right, now coming on to the posterior urethral valve, look at this. This is the bladder, and this is the dilated urethra. Okay, and this is seen in posterior urethral valve. This is the USG finding. Okay, this that you see here is the bladder, and this is the dilated urethra, giving it an appearance of keyhole. Okay, next up, okay, look at the ureter, the terminal end of the ureter. This is dilated, okay, giving it an appearance of a cobra head or adder head appearance of uretrocele. Okay, that's all about the images from renal system. Coming on to the chest x-rays. Okay, so what is the diagnosis here? Okay, so sometimes patient have a normal chest x-ray as well. So this is just a normal chest x-ray, and I have shown it because I wanted to label some of the structures here. So structure A, you see here, there's a little bit of lucency here, radiolucent structure, which represents the gas in the fundus. Okay, and this structure B is the costophrenic angle. C represents the heart. Look at this structure. This is the arch of aorta. So H represents the arch of aorta and D represents the descending aorta. This here is the trachea, which is going slightly towards the right, and that's a normal variant. And then if you trace the trachea down below, structure F represents the carina. Carina is the part where the trachea divides into two bronchi. And G is the hilum. Okay. Now, look at this chest X-ray here. The cardiac border, it's kind of broadened. Okay. So this is because there is pericardial effusion, and we compare this shape to a money bag. So money bag heart in pericardial effusion. Now we'll look at some more shapes of the heart. Tetralogy of Fallet, boot-shaped heart. Next, transposition of great arteries. Look at this. Normally your aorta is going to arise from your left ventricle, but here pulmonary artery is arising from your left ventricle and the aorta is arising from your right ventricle. So the arteries are transposed and the appearance that you have is a egg on string appearance. Okay, so this is how the X-ray is going to look like. Next, this. Okay, so there's a circle here and there's a circle here. Okay, so this gives a very interesting appearance. This is a snowman appearance. Okay, and this is a cute little olive. So this is seen in total anomalous pulmonary venous congestion, or TAPVC. Now this one is perforation. So this is just to remind you that in any X-ray, you are not just looking at the lungs, you also look in and around, and you can also find abdominal pathologies in X-rays, right? So this is gas under the diaphragm seen in perforation. So this is a pneumoperitoneum. Now, if there's a pneumoperitoneum, there is pseudo-pneumoperitoneum as well. So look at this. This is seen in Childati syndrome. Here, what is happening is that the bowel is interposed between the diaphragm and the liver. Okay, so normally the bowel will go like this, but here the bowel is going up and getting interposed between the diaphragm and the liver. So if you look at the X-ray here, the gas that you see here below the diaphragm is not a free gas. Okay, it is the gas which is present in the bowel. So this is pseudo-pneumoperitoneum. Next up, we have pneumothorax. So in pneumothorax, what is happening is that the air is collecting between the parietal pleura and the visceral pleura. And that's why the lung is getting collapsed. Now compare it with the radiological image here. The arrow is pointing out to the collapsed lung. If you see the normal lung, look at the normal vascular markings. This is lost here, okay, because the lung is collapsed. So it looks radiolucent, and this is the lung which is collapsed. Now coming on to Pneumomediastinum. Now this is usually seen in neonates. So this is the spinnaker sail sign. Look at this. Spinnaker sail or the angel wing sign. Okay, so what this represents is the thymus, the right and the left lobe of the thymus. Look at the cardiac border here. The right side of the cardiac border is obscured. And this is because there's a middle lobe pathology. And whenever you want to see a middle lobe pathology, you will make the patient in a lordotic position. So lordotic view is used to diagnose middle lobe pathology. So this is seen in right middle lobe collapse. Next, look at this lucency here. So this is in a shape of sickle. Okay, so this is the Luft sickle sign. Luft means air and sickle represents this sickle shape of lucency that you see here. So we will remember Luft as left. So left upper lobe collapse will give rise to Luft sickle sign. And the right upper lobe collapse gives rise to golden S sign. And where is the S here? Look at this S that I'm tracing. This is the golden S sign of right upper lobe collapse. Next, okay, these two are easy. This is pleural effusion and this is loculated pleural effusion. This cavity with an air and fluid level is the lung abscess. Okay, if you just see a cavity without any fluid, that is a cavitary lesion. Now that cavitary lesion is usually seen in secondary TB, and it can also be seen in squamous cell carcinoma of lung. Okay, so there are small dots here looking like millets. So miliary mottling. Now usually you will see it in TB, but it is also seen in sarcoidosis and histoplasmosis. Now compare this image with this. These are a little bit bigger, right? So this is the cannonball appearance, okay? So this is our cannon, these are the cannonballs. So cannonball appearance of lung metastasis. Okay, this is pulmonary edema, and what I have shown here is a bat. So bat wing sign of pulmonary edema. Right, this is air bronchogram. Now to understand this, I have taken this image. Look at this. This is the bronchiole and these are the alveoli. Now normally the bronchiole and the alveoli are going to have air, right? So they are not going to be visible normally. And what we see is the blood vessels, right? So blood vessels are what represents your vascular markings, which I told you before. Now imagine that there is some kind of fluid that accumulates in the alveoli, okay? So all these alveoli which are surrounding the bronchioles are having fluid, okay? So these will appear radiodense, that means they will appear white. And this bronchiole is having air inside, so it is going to look black. So that's why the bronchiole is going to appear prominent, and so it gives rise to air bronchogram. So whenever there is fluid in the alveoli, in case of pneumonia or pulmonary edema, in hyaline membrane disease, right, we will see air bronchogram. And this is very important point. In any case of lung cancer, you do not see air bronchogram except in adenocarcinoma in situ. Okay, this is the bulging fissure sign which is seen in Klebsiella pneumonia. So that's all for today's video. Bye.